getting started for today, we have a really special guest from Learning to Achieve Wellness, the CEO and founder of Learning to Achieve, Lillian Ingram. And she started Learning to Achieve Wellness with the vision of offering all patients, regardless of background, socioeconomic status, past history, or diagnosis, the opportunity to get the highest quality care in a comfortable and home-like environment with highly educated staff that truly cares about their patients. Lillian is always researching best practices and the most updated treatments to offer across Florida. It is her goal that every individual is met where they are in order for them to reach their personal mental wellness goals with minimal side effects and maximum results. And thank you in the chat box. Let's see. Alabama, Redding, California. Great to have you guys here. So Lillian's been working with us for how long would you say? A year, maybe?
Over a year, yeah, a little bit over a year.
About a year. And when I met Lillian just recently, she's been working with our amazing team. But what impressed me the most about her is her level of humility and also her level of success and how quickly she did it. So we are talking a less than 5-year-old business that went from one location to 14 locations, over 100 employees, and over $20 million in annual revenue. So I think I've read before that only a very small percentages of business ever make it to $1 million in revenue, like maybe 4%, I believe, and you've 20x that. So not only are you a great success story in mental health, but also a great entrepreneur and business leader. And so today's format is just going to be a fireside chat. It's going to be a conversation. I have some questions, and we'll kind of just freestyle. And it's a chance for everyone on here to learn from someone who has done it and is continuing to do it every single day. So. Lillian, it is great to have you here. Thank you so much for being here today. Um,
Thank you for having me.
yeah. So to start, why don't you tell us a little bit about your background story and how you got to this point?
Yeah, definitely. So I'm a nurse by background and did that right out of high school, became an RN, and I went like the long route. So registered nurse, got my bachelor's degree, then knew I wanted to be able to prescribe and treat for my patients. So I went back for my family nurse practitioner. Um, and went to Gonzaga University and had a really good background there, excellent education, and it was pretty well rounded with mental health components in there. I know they had a psychiatric program, and at that point in time, I was like, oh, I really kind of think I may want to do that down the line, but I stuck with the family because I didn't want to close off any doors. I practiced as a family nurse practitioner in Georgia, in very rural Georgia, and learned a lot about the socioeconomic challenges that many people face. Trying to get medications for people that maybe are at a very fixed income, even if it's covered by insurance, there's still those copays. And learned about a lot of the challenges that present possibly from untreated psychiatric needs. And then that brought me to Florida. I moved to Tampa, Florida. I started at Tampa Family Health Centers, which is a very like community serving, kind of like what we try to do as well. Serves everyone. They take the county insurance as well. So that exposed me to even more challenges, even more unmet psychiatric needs. Like out of all of our patients, we only probably had 2 psychiatric practices to refer to. So I saw that gap, and that kind of just drew me to being able to go back for my psychiatric nurse practitioner. Um, I got to practice and train with some really great people during that time, and it also exposed me to different environments like inpatient psych, hospitals with psychiatric consults, um, skilled nursing facilities, assisted living facilities, and then the office setting. So during that time, I was really able to, well, even throughout my whole career, observe kind of the things that I really liked about certain settings and or were good takeaways and things that felt like, if I was a patient coming here, how would I want this to look different? And what would make me feel more comfortable and be able to get help in an improved fashion. I so that's really kind of like just what brought me to being in the psychiatric field, and definitely got to have tons of great experiences though with great mentors in regards to like foundation of prescribing and getting that good feeling comfortable with what I'm doing before jumping into business.
Okay, great. So it sounds like you didn't have this grand ambition when you started to be a business owner. Did you have a defining moment where maybe something sparked in you where you said, okay, instead of, just working for a company, it's time for me to start my own company?
So I mean, since childhood, I've always been pretty much driven to be like successful and motivated. I mean, I used to be a figure skater by trade, so you have to be pretty motivated to do that. So I had a drive to always succeed at things. I don't think, like you said, I really had a drive to like start my own business. So what brought me away from working for other people is that I just slowly transitioned. So I like went 1099 at my job and let them know that I was going to start to see some patients outpatient. It wasn't competition because at that point in time I was seeing people in the hospital with geriatrics at the nursing home, so they were fine with that. And I just started to kind of build up slowly. Um, Really word of mouth. Like I wanted to be able to give my patients what I feel like they needed to have, which was like an hour-long consult, someone that kind of blended in that psychotherapy with medication management, and also brought in some other treatments for depression, not just conventional medication treatment. And from that, I guess, word of mouth is a very powerful thing, because if somebody likes what you're doing and they feel comfortable, then they're telling somebody else. And then I ended up just getting more and more patients without having at the beginning to do any kind of like advertising or going to local offices and telling them, hey, I'm here, like refer to me. And it just became a little busy for me to be able to keep up with. So, and then I needed to start adding providers with me. So that was not something I went into wanting to do. I actually started off a little bit in the wrong spot. So I didn't know that I was going to become what we are today. I thought it was just going to be me. So when I met with my accountant to open, I said, "Oh yeah, we'll just do sole proprietorship. That's fine." So I was Lillian Ingram Consulting, because it was literally supposed to be like a consulting for like an hour-long visit, maybe a little bit in a couple follow-ups, but then I'm sending you back with your treatment plan to your provider so you can continue, to do this. And then I had to kind of go back to the beginning, because I got credentialed with insurances under that EIN number. And that was a big takeaway at the beginning. When you're going into the business, making sure that you really know what could become of it going in as a corporation would have been nice, because it wouldn't have meant re-credentialing all over again with all of our insurers. But
Wow. Yeah. There will always be challenges on the road. So re-credentialing, waiting 3, 6, 9 months. I'm sure that wasn't expected when you went through that.
no, but we made it through. So really good at it the second time.
Okay, so there's already so many golden nuggets here. So, walk us through like who was the first person you hired or the first role? What were they doing? And then what were you delegating from your plate in bringing on that person or that role?
So my first person to bring on was someone to be able to triage the calls that were coming in. I did hire remotely first off, because I didn't know how much of an investment I was making into this company at the beginning. So I hired somebody remote. It was very easy to do because it was through a service. I wasn't responsible for all the benefits and things like that. I felt much more comfortable doing it that way. And she would be able to log in with me. She answered the phone, she made the appointments, really worked whatever hours needed to be worked. So that was a really comfortable way to start by hiring an employee, because I got used to just managing the person, but not having to deal with all the payroll and benefits issues. So that was a nice way to bring someone on. background as well, I had years of leadership experience and trained in leadership like academy with the state of Wisconsin when I used to work there. So I did have some background in managing people, which helps too, coming into managing a business. And from there, one of the first things I brought on, even when it was just me, was TMS treatment. So the magnetic stimulation for treatment of major depression disorder, also general depression with anxiety and OCD. So that was something that really made a big difference to me and to my patients. I wanted to be able to treat those items without having to add on medications or side effects, because I'm really big on wanting to treat people the best that I can and get them as best as they can, but without adding in any challenges to their life. So that was why I brought TMS on. So at the beginning, I was doing like the prior authorizations, and I was doing the consult, and I was doing the schedules, and I was doing every single treatment too. So as you add on a couple of TMS patients, that's 18 minutes a day. So the second person that I brought on was somebody to help me with the authorizations and the consult part, because it is hard to be provider and then also talking about insurance and money and things like that. You kind of want to keep those two things separate. So that was a thing I really wanted to be able to hand off, was the part about talking about insurance and co-pays and all those things. And then I brought on a kind of like office manager to help me start hiring other people, because then I needed to start bringing on nurse practitioners and therapists. And with that, I think, having a couple point step interview process, having someone that's able to help you with running background checks. And again, not having to be that um, it's hard sometimes to be in the position of being the owner and then also having the discussion about benefits and payroll and everything, because they know like you're the one that's making that ultimate decision. So sometimes having somebody that you can discuss kind of what the market trend is and setting those expectations, and then they discuss it with the person that's coming on, I just find that is a little bit easier as well. So I think bringing that manager on was a key item as well early on. And then we brought on 3 to 4 providers. I was still practicing out of the same little office that I was in, but it was like an office complex, so you could just keep adding offices on. So we kept adding offices on, and I think we got to office 7, and we're like, we need a actual building. So that brought me to buying our location that our Brandon office is at.
Whoa.
And
Okay.
yep.
There's lots to unpack here. So this is great.
Lots of stuff.
Yeah. So I find it so interesting that the most successful businesses, at least that I've come across, are they're focused on sales. A business does not exist without sales. And I find it really interesting that the first role that you hired was someone to help with all that inbound demand.
Mhm.
So taking it back a step even further from that, you said that it was all word of mouth in the beginning and it was just you.
Mhm.
So looking back now, like, is there something specific that you were doing or a process that you were doing with these patients to drive such, create such raving fans in your business that the phones are just ringing and ringing and ringing?
I mean, I think being able to provide an environment that somebody wants to come to, making sure that you're addressing each person with respect, and just like you'd want to be greeted on the phone, making sure that whoever is answering is doing that. I really do make sure that we're auditing everything. Even back then, I was very closely involved with every single process. So I like to make sure that I know how to do everything and be able to know each process. And I think that was a good reason of starting off small, because I did know what was going on in each level, and I still am able to manage at that lower level to the higher level today. Um, so I think it's just really important to understand what the customer's expectations are. Like, they want a calm environment when they come in. They want privacy with their provider. They want to be able to have somebody pick up the phone and answer them right away. I think uh, there's so many things now that can make that maybe a little bit easier. And I mean, I know I say now, it was only like 4 years ago, but with AI and everything, I think, being able to try to not miss a call, respond instantly. We were just talking about that a little bit earlier with the leads from Beyond. So I think utilizing resources right now to make sure that you never miss that first touch point with your patient or follow up. Because really, like, what are you going to do if you call to go make an appointment and they don't have an appointment open? Likely, you're just going to go to the next one on the list and like call them. So answering the phone is huge. Answering the phone with a warm, welcoming voice, knowing what questions you're going to ask, having a talk tracked, those kind of things is really important.
So don't leave anything to chance. All this needs to be processed out, is what you're saying, which is so important. So many people, get started and it's kind of like, flying by the seat of their pants, and process matters because, like you're saying, that's how you hold people accountable. And so this triage role, you said it was through a service. Was this a US based service?
Actually, it was outside of the US, so Philippine-based service, and I mean, really good results. Great, you get to interview people and be matched up with a person that works out well. So I was really happy with being able to have that level of assistance. And then I think just with growth, we wanted to make sure that we had people here too. We now have, instead of the general office where people would just come in, sign in, and then like a receptionist that worked at that office building would basically message you, your patient is here. Now, we moved to the Brandon location. We're there. It's our own office. Now we need to have front desk in person, greeting that person, and then they're able to answer the phones as well. So that's how that role kind of grew.
Yeah, and so we work with talent worldwide as well at our company, and including actually some of your call center agents. They're Filipino based, and for other people in other countries, it's actually very desirable to work for a US based company. Of course, you have the labor arbitrage. You can get a lot of juice from your dollars, and it's a win-win, and everyone's happy. So this is a really low risk way, even because it's low cost to get started. And I think you're spot on. If someone's not handling that initial phone call, the whole business is that first phone call. And if no one's there to answer or treat them with respect, compassion, help them right away, then all the other things, the office, the credentialing, all of this, how are we even going to get to any of that if we're not timely on our phones? So
That,
that's huge insight. That's huge insight. Um, okay, cool. Going back to we have so many questions here, but we also have just so much good stuff coming from this conversation. So the next thing you did was you hired an administrator, which is great to help with the prior offs, and then leadership. So you mentioned that you an office manager who helped with hiring and helped to, create some space between you and some of the decisions. So, how do you go about training and developing your people so that they can autonomously make good decisions for the business?
I think that comes back to just every step process. Like, if you can from the beginning, it's a pain to do it the first time, but if the first time you do anything, just like write it down. And now, I mean, there's all the services, chat GPT for business or anything. You can just type it in there. You can talk it in there once, and at least you have the process documented, and then you can make that into a policy, procedure, SOP. But I think if there's a way to be able to just, as you do everything the first time, document it down. Now, did I do that? No. Like, I had to repeat myself multiple times to people because I had to reteach and retrain it over and over again. But I found that I needed to then be the person doing the training at the beginning because I knew how I wanted it and like how we were doing things and our vision and our model and mission. So I needed to deliver the message every time. But had I just written it down at the beginning, had an SOP, maybe use some of the training material that's out there now, that probably would have lessened my load up front. But the way that we were able to have everyone be autonomous in their ability to make decisions is really just empowering with them with that information. Like, how do log in and onboard a patient for the front desk? For our medical assistants, like, let's get them trained in treating. So, and making sure that they're very good at taking a vital sign and what's appropriate conversation to be having during a TMS treatment, because they're in there for 18 minutes, and that's a different kind of thing for a medical assistant to go through. For our providers, we always have a period of 2 weeks that they spend with, it used to be me, or now it's usually one of our clinical directors, and they see how do they interact with the patient, how do they listen, how do they come up with a plan together versus delivering something that's kind of prefixed to them. So everything's custom approach to each patient. Um, so I think that helps a lot. Most recently, we've learned that, we want to even expand that further. So we have a program for our new graduates out of nurse practitioner school with their PMHNP called the resident program. Actually, it has some fancy name, but um,
What's the
so I
name?
call it the resident program. I know, I'm trying to think now. I'm like, what is the name on that manual? So this is the first time around. So again, now I've learned from going through things, and every 2 times a week, we have a lecture for an hour. The first time we do that lecture, we're writing it all down and delivering it. So then we'll have the document when we're finished with the first group. And then on Fridays, we have a day for just all exposure to all the things we do. So we do a lot of things that, like, maybe going through school, you don't necessarily learn. So we want to deliver that to our new providers and let them be exposed to it, so that then when they're talking to their patients, they're comfortable and they know. So specialty medications that's newer, that have less side effects, like Cobenfy for schizophrenia, or like the newer medications or long-acting medications for treatment of bipolar schizophrenia, TMS, Spravato. We use that AI chat with our patients in between that kind of lets them check in between their appointments. So we do some training on that. So all the things that they may have not been exposed to, and that makes them feel comfortable to be able to be with their patients, and be able to discuss that. And it was stuff that we just couldn't get to all within a 2-week training. So we found that this is the best way to do it. And then during that time, they have a 50% reduced caseload. So they have time to look stuff up and feel comfortable, not feel rushed. And so that's kind of where we wanted to get back to, because at the beginning, you came on and maybe you weren't quite as busy because we're new and we're growing, and now we do have a little bit more of like client base and people needing appointments right away. So we don't place those blocks right into their schedule. They potentially could be overwhelmed, and when you're overwhelmed, then it can come off to your patient as stress. And we want to feel relaxed and calm when we're talking to our patients. That's what builds trust, and also knowing about all those great treatments, because you don't want to go to you go to the one nurse practitioner, Susie, and she tells you, oh, you're going to take Prozac for your depression. That's what you come up with your plan. But then if you go to Jennifer, every time she's going to tell you about that you could have the option of TMS or Spravato, and this is like the percent of improvement that you could get from that, and this is like how you're going to have decreased side effects. So we wanted everybody to be delivering the same message, and that's how we found that we're able to do it, is through that dedicated training. Now, I'm definitely not done with that yet. We want to do the same thing. I think that's the most important place to start, is our psychiatric nurse practitioners. They see the most amount of people. They're the intro to the patient coming to the practice, because before they see a therapist, they see the psychiatric nurse practitioner to go through a full history and also see what type of therapy would be best. But so the next action plan would be to start to develop that same program for our therapist, and then our medical assistants, and then our front desk. And then eventually, like once we have the whole program made, I want to be able to make that accessible for other people too. So maybe you don't work for Learning to Achieve Wellness, but you want to be able to know how to apply these things into practice, or be able to just practice at a higher level. So that's the next step of that plan, is just to be able to roll that out for like for classes kind of thing.
Wow. So that's almost a whole separate business, an info product business, which is very exciting.
Yes, yes.
Very cool. Okay, so good training program. So this training program you just described is for graduates right out of school. Are these people who are working for learning to achieve wellness at the time, or it's people who are, pre being you know, located at a clinic?
Yeah, so right now, all of our residents are with Learning to Achieve Wellness. We do bring all of our employees, well, we do have a couple 1099 people, so I shouldn't say all. For the general amount of our people that work here are W-2 based, and that program is W-2 based as well. And then it's a 6 month program. So at the period of 6 months when that ends, we can decide, is this still a good match for them? Do they feel comfortable here? Do we feel comfortable with them performing? And during the time we're having consistent check-ins, I mean, daily we meet and review cases and go through charts and decide treatment plans. Just doing that at 11 o'clock before I got on here. So after 6 months, then it gives a good idea if they're a good fit for us and vice versa. So I think that's a nice
Wow.
way of bringing somebody on.
That's really smart because they're 50% reduced caseload, so they have time to like really absorb your process that you've designed over the last 4+ years, your whole career. But it's almost like it's a two-way interview as well over the 6 months. So that's really clever that you've set it up that way. What percentage of people end up staying with Learning to Achieve, would you say?
Well, we're in our first group right now, so
Okay.
they will graduate in October, and I mean, we're like, it's going to be a real graduation. We're probably going to do it though. We'll have dinner, we'll have graduation certificates. So, because it really is an intensive program, they put a lot into it, and then myself and the clinical directors have put a lot into it. There's the curriculum, there's the specialty learnings on Fridays, and then there's clinical discussions in between every 2 hours that they're working to go over medications and treatment plans. So it's intense, but it's amazing already to see the difference.
Wow, that is amazing. And so last time we spoke, that's great that you just broke it down on the operational and medical end, if you will. And I was really impressed with your processes on the sales end, the sales and marketing end, in particular, a process you made up. And I said, "How'd you come up with that name?" And you said, "I don't know, I just made it up." And so, can you talk to us a little bit about that process? What is it called, and like how it came to be, and how you guys use it in the business?
Yeah, definitely. So I think when you're dealing with people, they can easily often forget. I know if I don't get a reminder call the day before in a text, because I'm probably not going to answer, so I need a text, then I'm going to forget my appointment. And I may have already scheduled something over it and probably not going to call and cancel it. So, because we're all busy people. So, what we have the 3 days, 3 ways. And what this is just routine outreach to our patients. Like every patient is also a person. They have kids, they have responsibilities, they have jobs, they may have gotten asked to work overtime. Just because they didn't show up to their appointment or answer a phone call or answer a text doesn't mean that they want to disengage with treatment. It just means that they were busy. So we want to offer them the opportunity. Some people like to answer the phone, some people only answer text, some people want an email. So we offer 3 different ways for 3 days in a row to reach out if somebody's missed their appointment, if they need a reschedule. We need to get in touch with them maybe for a consult or a referral. And then after the 3 days for 3 ways, we step down to weekly because, again, maybe they're on vacation. I don't think just because somebody doesn't pick up the phone the day of their appointment or the day of a consult that it means that they want to be forgotten. It just means that they want somebody to reach out again and reschedule. If they say, hey, that's like a little too much, or I found another office, or no, I really don't need treatment right now. Okay, that's fine. Do you want us to put you down on the list to like call in like 3 or 6 months just to check in? Always offer that reminder, like we're still here for you. Even for our patients that decide like for whatever reason, maybe they're moving out of our service area, or maybe we're just not a great match, like we'll send a discharge letter when they want to discharge from the practice. It just lets them know like how can they get their records, what's the easiest way to get them sent. Obviously, like the other office requesting them, so we can just fax them to them. But it also goes over some things like these are additional services, so they can be reminded. Maybe their provider didn't tell them about TMS or Spravato, and they really, that was all they wanted. It reminds them that we have those services. And then also we give them some, like, if you lost your health insurance coverage, some sliding scale and self-pay options, because we don't want people to decide that they're going to just stop seeing us because they lost their job, they lost their insurance. Like, if anything, that's the time that you need help more than anything. And so then we try to work with all of our patients that way. So we bridge that gap. But yeah, definitely that, like 3 days, 3 ways, and then weekly. And I try to remind them a lot. They're probably like, oh my gosh, she's saying this again. But it's so important. It is, because otherwise you have this long list of patients that they're really not like, not your patient anymore. It's just like they need a little extra to follow up.
So you mean that if you were to follow up with people over the course of 3 days in 3 ways, it's not, are you're not bothering them or invading their personal space or anything like that? What do you say to someone who might be a little hesitant about, I'm a doctor. If they want it, they should just come.
Yeah, I think it's so hard, especially when we're dealing, I mean, with dealing with anybody, but also when you're dealing with mental health. Like that person might have been too anxious to answer the phone right then, or maybe they're like super depressed and just even texting back is too much effort. But you catch them the next day in the morning time instead of the afternoon, it's a little bit better time of the day and they're ready to engage. So I think making that decision for them isn't really fair. Like you don't get to decide that they just don't want, like they should just pick up the phone and call you. You have to be able to give them the opportunity. Are you bothering them? I mean, not really, because you can just type in stop on your text and then they'll, then it stops. So it's not like if the patient didn't want to be contacted, we're going to continue to contact them. So they
Wow.
have a choice.
This is so good. If you guys are getting value out of this, put a one in the chat box just so Lillian can see and know. If you're getting value out of this, just type a one in the chat box just like that. Christopher, Jen, Vincent. Wow, so good. So we have some questions coming in. I think it'd be a we're just freestyling everyone. I hope you don't mind. So Eric Conklin asks, where did you find funding for expansion and the bootstrap?
So it's probably crazy, but I didn't take any funding. So really everything that that's why I started small. So I started myself as I was able to make enough that I was able to bring on another person. And I knew that I had at least a fair amount of patients that I could have them see that allowed me to bring another person on. And I think as you grow, those numbers just become kind of bigger and bigger. It is important to make sure that each provider is probably at about 50 to 60% capacity before you're thinking about recruiting for another, because you don't want to get in the instance where there's not enough patients for the people to see. So then you're kicking out more finances than what's coming in. But also, you don't want to get into the situation where you're at 100% capacity and now you've got to recruit and you're going to lose patients because you can't get them in. Because our thing is like get them in within a week, because otherwise they're going to lose interest. So funding, no. Some days did I wish I had it? Yes. I'm not gonna lie, when you open, like I did 3 offices at one time at the same time, and just because there's a lot of need there and it made sense. Financially, that is hard because you figure that one of your other offices is kind of have to foot the expense probably about the first 3 to 6 months of that office coming on. So I think just figuring out like what's your bottom line, whether it be rent or mortgage, and then utilities, factor in your front desk staff. My admin staff, I usually just divide by the amount of clinics to be able to decide where I'm putting, their salaries at. And then what you're going to pay, your nurse practitioner or your therapist, and then see what that total amount is going to be. And then can one of your existing places be able to, pick that up for right now? So, I mean, I guess, living within my means and not extravagant. I'm literally doing the exact same thing that I was doing 4 years ago and taking the same couple trips and living in the same house and the same car. For me, growing the business and not having to rely on somebody else or having somebody else that I have to report my decisions to is more important to me than having a whole bunch of money. So right now, I just put back in what I get out and live within my means. But I know that's not for everybody. So, I mean, funding, I don't have great answers on because I just didn't like. I mean, like for our TMS machines, I did loans through them, so it's not like I just outright paid for our TMS machines.
Right.
But I think like that was just financing within the equipment company, and that is a good thing though. If you need equipment, buy it at the end of the year, taxes. So
Quick aside, what TMS devices do you use? Do you use the same one or different ones across your empire?
So started with NeuroStar device. Love them. They're amazing. Offer a significant amount of training. There is a session cost. I think, with that session cost also comes that you get somebody that's going to come out and help you and your staff with training. So that's an asset. And then now we have Apollo as well, no session fee along with that. So it's definitely a benefit in that we do offer like cash pay, sliding scale, and we do offer some full scholarships too. So it's really hard to offer full scholarship if you're footing the bill on the treatment session. But now I'm able to do that with the Apollo chairs. So we have both right now. We have some at each office. Typically, we have one chair at every office. We do offer all the same services at every single office. There's one office that needs to have two TMS chairs right now. So both, but there's benefits from each. So I love both companies. They're both amazing to work with. Great
Oh,
support.
So your strategy, back to the non-funding, but just it sounds like it sounds like you took your process of making processes and being, knowing how everything works. It sounds like you took the same approach like with the finances in the business. So you don't want to, at what point, capacity wise to a provider, you said you don't want them to be 100, right? Because then you're busting at the seams, but you don't want to maybe do it too soon because then maybe there's, two half empty calendars. So like at what point, at what capacity of a provider's schedule do you look to bring on the next provider or bring on the next location?
Yeah, look at that like 50 to 60% for starting to look for the right candidate, and then around like the 75, 80% capacity for hiring because you figure just have one person call in that day. And I hate to do that. Like, even if somebody calls in, I would much rather be able to reorganize our patients for that day and get them over to somebody that maybe has like an open spot. So, like, we want everyone to be at about 80% caseload when they're at their maximum ability. But it is nice to have that little bit of opening within the day for if somebody were to call in, then we can disperse patients. If for some reason something happened and they have to leave, or we're able to disperse our patients and not have our patients feel that burden. What else happens sometimes? I was thinking of that. Oh, like acute visits. We have people call in, they're in acute need. We want to be able to get them seen that same day. So
Gotcha. Makes sense. I know when I have like a full meeting day, like, and I don't have much time to debrief or work after, I'm like, I didn't even work today. Like, I got to get to work. So having that buffer built into their schedule, you can't just see, patients for 8 hours straight. Maybe you can, but.
definitely.
Yeah. Okay. Great. So back to some questions that we're getting. So Vincent is asking, is 3 days, 3 ways if they miss their appointment or leading up to their appointment?
We do it right now, just like if they missed or they canceled or no showed. So that's where we've been rolling it out. Leading up to, we do the automated reminders through our medical EMR. We use Advanced MD. You can set the amount of reminders you want and the frequency. So I think right now we do a week and then 3 days before, and then the day before, and then that morning, if they're televisit, they automatically get the link sent to them.
Got it. Okay. And so we have another question in here from Christopher. Actually, two questions. We have a lot of clients that just drop off of the schedule over time for whatever reason. What retention efforts do you take? Do you do outreach if you haven't heard from them in some time?
Yes, so we do have a couple different, like the 3 days, 3 ways, and then weekly is pretty much more immediate. But we will run a list, usually about quarterly, of what patients have we not touched base with in some time. And if they didn't ask to be discharged and they're not marked as inactive, we will have our remote receptionist give a call out to them and see if they want to engage with care. Also, we'll have TMS treatments that have graduated. They've only come to us for TMS, and we always want to follow up with them at about 6 months, a year, and then annually to see if there's a need to retreat.
Great. So as the owner and also the provider, where do you spend your time in the day to day? What are your day to day activities and strategies look
I'll
like?
follow my lead on that one. So I right now still see patients. I start my day at the hospital every day. It's a psychiatric hospital. I've just been going there forever. So I start my day there. I see my caseload of patients. And then I try to get to my office space, which you think with, 14 offices, I'd have a spot at one of them. But I just have my own office location. I use it for meetings. It's also central to all the locations. So if I were to need to get to one quickly, I mean, I'm relatively in the middle of like the central located ones. We definitely have outliers that are a little bit further away. Um, and then I spend my day mentoring our directors. I just recently had clinical directors come on. So now they're between me and the providers. At the beginning, it would have been spending a lot of time answering questions, helping with medications, consulting on patients. Now they manage that for me. Um, Touching base with the things that may be going on in each office. I think with all those people, usually there's something happening every day. Um, we have some regularly scheduled meetings. Now, coming from a background of management in the state, I have some great ideas as we grow, how I want organizationally to structure like our meetings and our check-in meetings. It's just we're not very top heavy right now or anything like that. We're very even, and a lot of our people that are in administration are like our clinical directors are also still carrying a client load, which is good because then they know what's going on when they're talking to the providers that they're supervising. Our managers are hands-on. They've been front desk, they've been MAs, so they know how to do the job, not just supervise the job. And I think because that's kind of how I've grown, that's how I like our people within the organization to grow.
Wow, leading by example. You're still seeing patients every day. That's amazing. It doesn't matter how big or how many locations, like you're doing the work you were doing day one. So,
Yeah. I'm looking at charts, I'm looking at our numbers. There's so many things that happen in a day. Um, Gosh, like, I mean, Spravato we do, that takes a lot of time, making sure everything's running right, talking to vendors, talking to partners. I really like to try to keep a really good relationship with anybody that we touch base with because I feel like, you never want to burn a bridge and you always want to make sure that you have those good networks and connections. And I think I saw something pop up in there about referrals and like how do we get our referrals in, and it's just multiple sources. I mean, we work with Beyond Marketing, so that's been amazing. We were talking about our numbers right beforehand. I think we did really well this month.
54 new patients according to your move dashboard, which is really good, really amazing.
We're only like into 17. So, and then I was just mentioning too, it was very helpful with having the move dashboard. We don't want to ever miss something coming into there. So electing, and I don't want to say it wrong, but the AI and then the person that is added on with that has been helpful too. So Ella is our person there. She's amazing. She coordinates with our staff. So if, and our staff are in the CRM as well, but she's also there keeping an eye on it and doing a warm handoff. So I know our staff love her. They're like, Ella emailed us. She gives us all the information we need. So that's one way. Another way is we do multiple things. So I mean, as I was growing and learning, I learned in a lot of different environments. So we serve nursing homes, ALFs, offices, and hospitals as well. So we have good connection with our partners that potentially are referral sources, which would be like case managers at the hospitals, insurance companies. We're able to make it a priority to get patients in within a week. When somebody discharges from a hospital, when patient needs help, they like to see that people can get an appointment right away. So I think that's been helpful. They send you those little emails, and we always try to respond right away that says, like, we have a 54-year-old patient that has depression, and do you have somebody to see them? Just respond with the date and time. I always keep a date and time open for those kind of responses. Um, Connecting with area organizations. You want to embed yourself in each community is going to be a little bit different. We're in many different counties. Sometimes the organization that kind of leads the mental health efforts there is NAMI. That's a good connection. Giving back. Like, I mean, we give back as much as we can. Hey, there's a NAMI event. Let us donate to that. There's like children and family mental health event. Like, can we get involved with that? So you might not notice that you're getting a lot of leads that day, but I think, somebody picks up like your little pamphlet at the desk, or they keep it with you. Each event that we go to, I make sure that we have like 3 or 4 items that aren't super expensive, but maybe like some sunglasses, a squiz ball, like a little bag that has our name. Always make sure that we have our phone number on it. I mean, we've got like our little different, now we have a whole bunch of different handouts, but like we have like our little brochures. I mean, I've got a general one, I've got TMS, I've got Spravato. We customize anything that we used to be able to get from like inside. I mean, there's like the little different services that we offer. So I think, I'm even when we were before we had handouts for everything, and maybe we had just the Spravato guide, or we had just the GeneSight stuff that comes from GeneSight. I was like, none of that goes to a patient without a sticker on it. Like, just slap a sticker on it, because if they pick this up and they're like, oh, I'm so interested in this, I want this now, and they see the general number, they're going to call that general number, and who knows who they're going to refer your patient to. So, like, if you're using any kind of material from that's general, just buy a sticker off of Canva and stick it on there with your phone number so they know who to call for that service. I remember at an event, I was like, oh my God, there's no stickers on here. I'm going to keep that on there.
Wow, so you're seeing the world through like, okay, here's what I would do different or better in my business. That's awesome.
Yeah. So, I mean, I really just trying to be at events, look up some events that are going on. It doesn't have to be mental health focused. It can be really anything. There is a lot of wellness things. There's some pop-up markets. Sometimes those are free. I mean, it means, you got to go out there and sit for a few hours, but it's worth it. And then also, depending on, who your potential referral sources are, stop in the office, hand out a little bit of some pens or notebooks, and this is how you get in touch with us. And that goes a long way too.
Yeah. Great. Okay. And then follow up to that. So that was how are you generating most of your leads? The follow up would be, and I people ask us this too, and I'm just like, listen, we have clients who do it and don't think twice, and everyone's happy. But so the question is, how do you manage Google reviews while still being HIPAA sensitive?
Oh, I know. You want to just respond to all of them the nicest you can. I mean, it is frustrating, especially when you know like the situation and you're like, okay, well, that's not exactly how it happened. But I usually just will like put, if it's like a negative kind of thing, like, thank you so much for reporting that concern. Here's the best way to be able to get in contact with. Sometimes I'll put that office manager, sometimes I'll put just our general email, like the info email. You can send us a summary of what happened so we can call you and discuss it and follow up. Because if you get something negative, you definitely still want to respond to it. The positive ones we want to respond to too. Um, we do have like a little plaque, you know, when you check out, if somebody wants to scan and leave a Google review. I think that's encouraged some Google reviews. We also try to do some staff engagement stuff every month. So I think February was like show me the love. So it was like whoever got the most Google reviews at their office, like won a prize. So encouraging your patient or your staff to be engaged. I mean, you don't want them being like, hey, you know, give us a review today, but they can say, you know, at checkout, like, here's the scan code if you want to leave a review. I think most of them probably come from in office. In some of the EMRs, you can set up like a little automated invite to leave a Google review even off after a virtual appointment. So I found that AMD does that. The only challenge is it only lets us, so I mean, with the different locations, each has its own Google review. So when they check out of AMD, I'm only allowed to have one link for a Google review. So like they all end up going to like our Brandon location. And I think the patients that aren't scheduled at that Brandon location don't always get them because I've had patients be like, I didn't get the Google review for my appointment. Why didn't I get it? I'm like, I
I'm
don't
looking out.
know.
I'm looking right here. Learning to achieve wellness. Yeah, several locations for all yours. 4.8, 264 reviews. 5.0, 5.0, 5.0, 177 reviews. 4.9, 264 reviews. So, I mean, you guys are crushing it on the reviews front. So that's amazing. Reviews are so important. We tell people to read our reviews, this, that, and the other. We so also Chris to follow up with how do you get reviews? What I typically train our team on is that whenever someone's at the height of like giving a compliment or a praise or oh hey this really good thing happened and they're sharing it, that's the exact moment we want to ask for a review. Hey, that's great that you had that experience. Could you maybe leave us a Google review, scan this thing so that other people can find out about this and maybe have a similar experience? So at the height of them, giving a compliment or praise is typically the opportunity, the best time to ask for it, I find. Cool. We got 6 minutes left, Lillian. We got some good questions to end us off with. Two questions actually. So we'll start with this one. How do you navigate hiring good employees willing to come in office in a competitive environment where telemedicine is becoming the norm?
Oh, that's a challenge. It is hard. It's so hard to sometimes find like your really good employee. I think just knowing you're going to have turnover. So, like, I mean, I lost, you know, when your first provider leaves, I think that's like devastating. I'm like, oh my God, what did I do wrong? And all these things. But really, I mean, it's just sometimes not a great fit, or maybe they learned whatever they wanted to learn and they're moving on and growing. I mean, I think having some contracts in place for your professional staff because you have dedicated a lot of time and money and effort into them is a good idea to ensure that it's fair for both the employer and for the employee. For your frontline staff, it's sometimes hard. I mean, I said the other day, I'm like, why are we even doing interviews? It's like 50-50. Let's just choose. Because sometimes people present so much differently in an interview than they do when they come to work the first day. So one thing that we did in response to my comment about it's 50-50, let's just pick, like, because you never know what they're going to show up at like the first day, is doing like a shadow. So a lot of times if somebody's really interested in the position, they will agree to maybe do like a 30-minute to an hour long shadow session. What does that do? I mean, obviously, we don't want the person to just feel like they're coming in and working for free or something, but it allows them to see like what are our values? How do we interact with patients? What are some of the things that that physician is responsible for the day before making a big commitment on their side? Because they might have to give a 2 week notice at where they're comfortable at. And on our side, because we're putting a lot of effort into training somebody. So I think, if somebody makes it past, what we do right now is a 2-step interview for our front desk and medical assistant staff, and then for our professional staff, do a 3-step interview. So for professional staff, it would be like their one clinical director and then 2 others, and then final step would be like HR reviewing all expectations, making sure we're aligned. And then for front desk and MA staff, it would be with the manager and then HR after that. So, and then offering that shadow experience. But it is, I mean, being able to lay out opportunities for improvement, being able to be open with what's the raises that are going to happen and what happens when you're here this long and that long, and offering benefits. I mean, people want to make sure that they dedicate a lot of time to being an employee at your organization. So just making sure that you're also giving back to them is important.
Take care of your people. They take care of the business. We have this is actually a great question to end on, so I'm really excited.
I got a minute and 30 seconds. Okay.
What's next for Lillian Ingram? More expansion, new systems. Have you been approached? Are you looking for an exit? What are your goals? What does the future look like for you?
Oh gosh, I think my husband would love if I said I was looking for an exit. He's like, "Are you done with this yet?" No, not done yet. I want to continue to be able to grow across Florida. I would love to be able to expand out of Florida. I think that systems need to be very regulated and in place in order to be able to expand that way. At some point in time, I mean, most definitely, probably, I will. Exit, but not right now. Right now, I feel like there's still too much to do. I say, 5 years down the road, hopefully I have everything laid out. I want to be able to offer some more opportunities for people that are trying to do the same thing like that I am, so that they're able to do that. This was great to be able to talk today, be able to offer, expertise in what I've learned so they don't have to make the same mistakes. And that goes along with our training program then too, like developing that training program that I'm able to outsource to others. So that's the step. Hopefully I'll have it all tied up in a pretty bow by the end of the year. We'll
Wow.
see.
Keep on building, keep on rocking. That's the answer. So great. Lillian, this was so valuable. This was amazing. People are going crazy in the chat. So if people want to
I
stay,
saw how to run training programs. So maybe we can just get some information for my contact information afterwards. But info at ltaw.net. I read every single email that comes into there. Just send me an email.
oh wait, info at ltaw.net. You're like me. We got stuck with the .net domains, but that's okay. We're still making
Well,
it.
we do own learningtoachievewellness.com, but that's too many letters for everyone to spell. So it converts all into one email somehow. I don't know. IT. Lovely.
Okay, beautiful. Info at ltaw.net to stay in touch and get more info. Thank you so much. This was amazing. We really appreciate your time and sharing so openly and excited for the next one.
Thank you. Thanks for all the engagement and questions. I'm so excited. Have a great day.
Cool. You too. Take care.
Bye.